Dr. Sean Tierney here, going over some nerves to the hip and also how the diaphragms affect the hip, how the nerves to the diaphragms affect the hip. So let's go through that pretty quickly here. First thing off is if the hip issue is an issue, one of the first places that I think if there's lateral hip pain or posterior hip pain is there thoracolumbar issues and is there a diaphragm paralysis? So I'm going to look at the neck for the phrenic nerve. Then I'm going to look at the diaphragm function. I'm going to look at the pelvic diaphragm function. I'm going to look at the individual nerve roots, C3, 4, 5. They keep the diaphragm alive. For the phrenic nerve, look at the phrenic nerve in the neck. Scan for tenderness. There's tenderness at those nerves, and the diaphragm is partially paralyzed or paralyzed on one side. I'm going to correct that with whatever method I have, a hydrodissection adjustment, whatever is available to the provider. And then we're going to go ahead and we're going to look at, how does this all affect? So let's take a look at this posterior hip nerves. It's really kind of a complicated system. What I did is I mapped these nerves out with ultrasounds. That's actually where they are. So you can see there's 3 nerves coming down over the PSIS. Now these 3 nerves are mostly responsible for what people call sacroiliac pain. It's usually not sacroiliac pain. I can say that because we do hydrodissection and blocks all the time. So the majority of the pain, which makes sense for chiropractors, is from the facet. So you can see the nerve roots. This is where the nerve roots come out of the spine. This is L1, L2, L3, and they come down and become these superior clenual nerves right over the PSIS. And this is the spasm of pain you would feel in the upper glute right here and over the PSIS. So these are the superior clenual nerves from L1, L2, L3. These are the nerve roots coming out. Notice L1 is going to come over and become this, go over the lateral hip as that ilioinguinal, iliohypogastric nerve coming over the ilium. So this is L1 pain. Commonly confused with nerve pain associated with superior gluteal nerves, which is rarely the cause of the problem. So then we can go back to the next nerve over here, which is going to be the subcostal from T11. It's coming down in a straight line. You see this pain pattern. It can go all the way down, and you can see how it interferes with the sciatic nerve. This is the exact pattern of the sciatic nerve, relative size as well. And then this is the postcutaneous nerve of the thigh. Coming this way, I should have some nerves coming this way. There's inferior clenual nerves that are branches off of that postcutaneous thigh. So there's inferior clenual nerves coming this way. It can be associated to the hip. This is the pudendal nerve wrapping around the obturator internus into the Alcox canal. And these are the medial clenual nerves coming from the sacral foramen S1, S2, S3 sacral foramens. And that's exactly where they come out. So we can map those to the surface versus the ultrasound underneath. So we understand these are some of the nerves that are commonly associated. There's a superior gluteal nerve that's going to come out just above this. There's images of that coming out through the gluteal muscles to the trochanter, which can be irritated. And like I said, that's very, very rarely the case of this lateral hip pain is associated to that superior gluteal nerve, but it could be. So maybe 1 in 1,000. This lateral hip. On the other hand, this L1 origin pain on the lateral hip is very common, very, very common, and over 50% of the lateral hip pain you'll find is from L1. So then we're testing the pelvic diaphragm, we're testing the thoracic diaphragm, we're addressing the nerves. Now there's the sacral plexus is going to be up here, coming out of the piriformis. The superior gluteal nerve is going to be right above that. So the pudendal nerve could be impinged at the sacral plexus, or as it wraps around the obturator internus right about in through that pattern. I show that whole path of the Alcox canal on the ultrasound in a few seconds here. So let's go ahead and switch from the surface anatomy. We did a lot of work to mess this up. I'm just going to, one more time, just going to go through sciatic nerve, postcutaneous nerve of the thigh, pudendal nerve, medial clenual nerves, superior clenual nerves. So that's S3, S2, S1. This is superior clenual nerves, L3, L2, L1. This is the subcostal nerve, T12 nerve root coming down. This is the subcostal nerve, T11 sacroiliac nerve coming down. And then this is the L1 nerve root, ilioinguinal, iliohypogastric, coming down over the ilium. So those are that L1, and we'll look at that in the images in 2 seconds here. So let's go ahead and turn the lights off. Go over, we'll look at this little computer right here in front of me, and I'm going to go through just this. Start off with C3, 4, 5. So here is the transverse process of C3. You can barely see the nerve root coming up through there. Let me go to the next one where we go to C4. The nerve root seen right over top here. Let me get a little bit better image of that nerve root as it comes come further down. Here's C3. Now we can actually see the nerve root coming out a little bit further down. Here's C4 nerve root coming out. You can see it going up and becoming. And that branch right there is going to be the phrenic nerve. So you can see that become the phrenic nerve. Now notice this is underneath the sternocleidomastoid, this muscle here, with a bunch of lymph nodes. You can even see that little lymph node pop right here as I'm scanning through. So it's not unusual to have a lymph node that's irritating the phrenic nerve and causing a partial paralysis of the diaphragm. Therefore, and then continues to cause excessive torque on the thoracolumbar spine, causing injury, irritation to the nerve roots 11, 12, 1, 2. So then we're going to just be aware of that, and we're going to be aware that we may have to start at the phrenic nerve. We may have to start at C3, 4, 5. So that's C3 again, nerve root coming. You can see that phrenic nerve coming, that nerve root coming out, and a branch of it coming out to become the first part of the phrenic nerve under the sternocleidomastoid. Here you can see that this little phrenic nerve right here. Just froze it so you can see it clearly. Here you can see C5 nerve root. This is the anterior tubercle of the transverse process. C5 posterior tubercle of transverse process of C5. This is the tubal disc here. You go back through and so now we can see C5. And we can see that branch coming off. That actually became the phrenic nerve combined with C3 and C4 in that area. We go back to C5 again, another image of C5 a little bit further down, and we can see those nerves coming off. One of them is going to form the phrenic nerve. Dorsal scapular nerve is going another direction, more posterior here, and then you're going to have your long thoracic nerve coming a little bit. So probably dorsal scapular, long thoracic coming through there, through those scaling muscles. And then you see C5 here with the anterior tubercle and posterior tubercle. You see the SCM over the top. There's a little where you could have some lymph nodes and irritation. Now, we're going to go down to just watch C5 nerve root, because we were showing the nerve roots in cross section. Now we can see the nerve root coming right out through. This is all nerve root. This is not a vessel here. This dark space is all nerve root of C5 coming out, coming through the transverse process of the spine. There's C4 again. You can see the nerve root a little bit more clearly here. So we'll say it's like a banana shaped C4 nerve root. You see the branches coming up to become the phrenic nerve. C4 again. C4 nerve root here, and you can see that phrenic nerve starting to form up above. And here we go back down to so the diaphragm is off. Now T11, T12, L1, L2 parts of the spine are vulnerable and torqued and possibly injured. So now we have a T12 problem. Super common if you have a diaphragm problem. So just how do I identify the T12 rib, and where do I know it's going to be tender? So what we did here is we just found this quadratus lumborum coming over the kidney. This is the 12th rib right here, and if there is that subcostal nerve right where we see that insert, there's going to be some tenderness here. It could also be irritated by lower nerve roots that are coming over that QL. It becomes that little part of a little plexus. It becomes relative to that T12 subcostal nerve over the glute milium. So this is that T12 kidney, paraspinal muscles. Really, at this point, it's going to be mostly the lat on top and the iliacus cells, also right here. Okay, so now we're going to go through to the next one. Here we see the 12th rib and long axis. Here's a transverse process. What little there is. This is the more articular process of T12. And this is the rib coming out with this. This is a little ligament called the costal transverse ligament. You get into that space, or into the space where the rib is going to be, where the nerve root is going to be, and that flow into that area would probably go, all around the nerve root, possibly intrathecal. But this is the rib coming across. These are the paraspinals. And now you can see the nerve root actually coming out. So this is the intercostal muscles here. There's 3 layers. Kidney down below. This is the pupil body. This is articular pillar. T12, L1, and I'm going to go down. And we're going to go back to another view of the T12 rib. Now this is cephalad. This is caudad. So we were previously looking at, in this previous image, we were This is lateral, this is medial, right? So now we're going cephalad, caudad, and this is the nerve root of T12, kind of just lateral to this to the facet joints. That's that close to that chair view, you might call it. Here you can see the nerve root of L1. That would be the needle path to do the 100A section. The nerve root itself. Now I go into that because that L1 nerve root is obviously associated with hip pain in multiple ways. So we're going back to look at the L1 nerve. You can see the radicular artery coming in there. Let's go ahead back to the L2 nerve root here again, and we go to the procedure direction for that. Here's the L3 nerve root. We call this a little chair. So this is the kind of pedicle superior articulating process. This is where the nerve is going to come out. There's an intertransverse ligament right over top. That's the L4 nerve root. Also could be involved with hip pain, of course. And that's more associated more with the femoral nerve than the posterior hip pain for most people. I'm going to go back and just to get an idea of what the anatomy is here. So we have your psoas. This muscle is psoas. This is kidney. This is the quadratus lumborum. This is the ilium lumborum. This is going to be our longissimus and our rotors. And this is our spinal canal here, articular pillar here, vertebral body here, psoas, kidney next. Okay, another just a little bit further down. So now we're looking at the sacrum here. So this is the sacrum. This is L5. This is cephalad. This is caudad. This is S1 coming out on an angle. This going caudad, and S2 is coming on an angle. More from posterior to anterior, goes from cephalad to caudad. So you can see this kind of loop coming over. That's S1. That's S2. It's relative because those medial clinical nerves are coming off of those posterior parts of that nerve root coming out of those foramens. So those are those S1, S2 nerves. And I'm going to go down a little bit lower. I'm going to look at this sacral plexus. The sacral plexus coming under the piriformis. It's the piriformis. We're going to see the superior gluteal nerve coming through here. We're going to see the sacral plexus coming through here with the sciatic nerve very clearly seen at this point. And the sacral plexus is going to be nerve of the piriformis. It's going to be the pudendal nerve, the postcutaneous nerve of the thigh. Then you're going to have an artery called the inferior gluteal artery, and the other side of that artery is going to be the sciatic nerve. So you can see that nerve coming out, and it's coming a little bit over between the gluteus maximus here, superior gemellus here, obturator internus. I'm going to get a better look at that a little bit further down as we follow that sciatic nerve further down. So here's that sciatic nerve again, and long axis. So we see, obturator internus, superior gemellus, obturator internus, inferior gemellus, quadratus femoris, obturator externus. So we have that understanding of that sciatic nerve coming down through the gluteal musculature there. See a little clearer view of the nerve, same muscles here, and go back through. Here we see the nerve in cross section. So here we see the sciatic nerve, a little bit of the posterior cutaneous nerve of the thigh with that inferior gluteal artery between. This is the obturator internus. I can see it kind of wrap around the corner. It means this is going to be the postcutaneous nerve of the thigh in this area, and pudendal nerve is going to wrap around and go into the pelvic floor down here. So this is going to be your levator ani muscles here versus your glute max over the top, and that's the. Just going to show a little video, so maybe we can see what happens when we externally and externally rotate. You see that obturator internus muscle belly coming around here, a little bit of the inferior gemellus on this side. And we're going to go to the next one. Now we see very clearly the central tendon of the obturator internus coming across the hip joint. So here's hip joint, and it's coming into the trochanter. It really inserts more above the trochanter, a little bit into the trochanter, but it inserts under that conjoin of muscles and tendons. Let's go through this obturator internus, the tendon here again, and another view here. We can see this is very clearly obturator internus all the way around. So before you saw a little bit of superior gemellus, now you see tendon. And then right over top of that tendon, this little disc right there, that's the sciatic nerve in cross section. You can see that's a fairly large nerve. And you see this is the inferior gluteal artery. Right on the other side of that is going to be the posterior cutaneous nerve of the thighs. And deep to that is going to be kind of the pudendal nerve wrapping around the obturator internus and Alcock's canal. And let's just see what is the thickness of this sciatic nerve. How wide is it? At that point, it's 2 centimeters wide. 2 centimeters. That's the sciatic nerve, 2 centimeters wide over the obturator internus in this patient. I go on to that next thing. Okay, so I can see this is the, as I said, the Alcox canal wrapping around it. We're getting the levator ani here, and then you can see this pudendal artery traveling with the nerve, and so it's wrapping around that arterial internus. Commonplace for impingement points is that pudendal artery and nerve enters that pelvic floor, wrapping around the arterial internus. So that's something we want to be aware of, both for procedures and for physical rehabilitation. And I go and watch. Hopefully, I have that's the line we may do a procedure to dissect this fascial plane, wrapping all around through Alcox canal, going right through the glute max here, and right on the superficial side of the arterial internus muscle belly. We go to the next video, and I think it might show. It's kind of scanning up and down, so you just see the vessels here, and here I can see, if I scan up, I can see the artery kind of move into the pelvic floor and out of the pelvic floor. Here I'm looking at the superior gluteal arteries. You're going to see the superior gluteal nerve here in this fascial plane between the gluteus minimus and medius. There's a maximus over the top. So this is a superior, and this is inferior, scanning straight out from the sacral plexus towards the trochanter here, and we just see this branches the superior gluteal arteries and nerves coming through those gluteal muscles. Like I said, rarely do we find when we do the procedures that that's the cause of the problem, but it could be in a very small percentage of people. And we're going to go ahead and look at that superior gluteal artery coming around. This is out of the sacral plexus. So that artery is coming up over. This is here the ilium here, and this is the piriformis. It's going to wrap around just lateral to the SI joint and go through. So let's see if we got some more telling images. Superior gluteal nerve there. Here we see the sciatic nerve. This is an interesting area. This is where we have your quadratus femoris right here, and your arterial internus here. And this is your conjoint tendon of the hamstring, with the sciatic nerve sitting next to the hamstring. You can see how that sciatic nerve could be irritated if there's a hamstring tear. This is going to be more of the top of that conjoint is going to be the semitendinosus. We're going to have the biceps and the semimembranosus on the lower side of that conjoint there. This is the conjoint tendon just a little bit further down from the ischium where we were, where we can see the sciatic nerve. We can see the postcutaneous nerves of the thigh are going to be right over this tendon conjoint between the glute max and the conjoint. We're seeing some of the semimembranosus muscle belly here. This is the adductor magnus. You can see that sciatic nerve is sitting between the adductor magnus and the glute maximus. And a little bit further down, between the as we scan down the leg, if we did scan down, it would be between the adductor magnus and the biceps femoris, the long head, of course. So this upside down T, we call it, would be the semimembranosus tendon, the conjoint tendon of the hamstrings, and the sciatic nerve. This is the sciatic nerve. You can still look out how wide that is. You see that is this one 1.9 centimeters, still fairly wide nerve. No exaggeration. The diagram we put on the glute, that nerve is wide. Okay, so let's go back down to the next slide, and we're kind of understanding, nerves around the hip. Here we see the sciatic nerve, a little bit further down, that upside down T, a little bit further down, and here we're looking at not a nerve. So this is that conjoint tendon of the hamstrings, and we see a nerve over the top. That's a postcutaneous nerve of the thigh. Branches of that will become the inferior cleal nerve and also the perineal nerve. There's a branch of the perineal nerve from the postcutaneous nerve of the thigh, as well as a branch of the perineal nerve from the pudendal nerve. So this structure is not a nerve. That is actually a tendon, and we call it the sacrum to tuberous ligament. It's actually not a sacrotuberous ligament. It's actually an extension of the semitendinosus tendon. So semitendinosus inserts some on the ischium, but it really inserts on the sacrum. And I take this picture here because this is, you can see the beginning of Alcox canal. This is in this area, and this is actually the pudendal artery with the pudendal nerve around it. So this is pudendal nerve and artery underneath. You can see if you injured somebody tend to notice this tendon, how that could have an effect on your pelvic floor and on your pudendal artery and nerve. So I'm just going to go forward to the next slide where we just see that artery with a little bit of Doppler on it. We're going to go back to look at just the gluteal muscles as these nerves pass through here. So this is going to be, remember this is the artery divides between the sciatic nerve on one side, the lesser sciatic nerve on the other side, really also called the postcutaneous nerve of the thigh. And there's it kind of scans all over this hamstring conjoint with somebody tend to notice this underneath. This muscle is kind of like, some people say it looks like a snake biting an egg. So this is that snake, mouth of the snake versus the body of the snake. Okay, whatever. This is the inferior inferior gemellus right here, coming in to insert with the sciatic nerve over the top, gluteus maximus over the top, and we got maybe a little bit of quadratus femoris coming in. Here we see that obturator internus coming around the central tendon, and we see those nerves again here. We see the postcutaneous nerve of the thigh, the inferior gluteal artery, the sciatic nerve, the pudendal nerve wrapping around into the pelvic floor over here. This is where I like to palpate the pelvic floor. If the person breathes in, should rise up, contract. If breathe out, should go down. That's the pelvic floor. Here we see the superior gemellus. So the superior gemellus is above the obturator internus, obviously. And we see that sciatic nerve right sitting very clearly here with that inferior gluteal artery, and then we have this superior and postcutaneous nerve of the thigh. It used to be called the lesser sciatic nerve, along with the pudendal nerve and artery. And this is that sacral spine. A little bit different, very very slight movement. We would see a sacrospinous ligament there. So here we see, quadratus femoris, arteria externus, and the sciatic nerve. This is all sciatic nerve, a little bit out of plane, with focus on the conjoint tendon here over the ischium, and we see the femur here. Okay, now we're looking at some of the other possibilities of hip pain. It could be because of the gluteus medius minimus insertions, and actually on the lateral side, the piriformis insertion and obturator internus insertion. So this is the gluteus minimus insertion, gluteus medius insertion. This is the trochanter. This is the lateral facet, the posterior facet, the anterior facet of the femoral trochanter. And we're going to come down a little bit and we'll look at this gluteus medius inserting laterally, that lateral facet over that trochanter, obviously going to be surrounded by the superior gluteal nerves there. And here you have the gluteus medius again coming in to insert more of a footprint. Here it looks a little bit more like a rotator cuff tendon. Here we see the gluteus minimus in cross section. The gluteus medius over the top. This is I'm trying to show the minimus here. Cross section, very wide, broad tendon. And here it's more muscle in the gluteus minimus. It has kind of more of that wagon wheel appearance, similar to a subscapularis tendon in the shoulder. So we're going to go in and look at the next slide, where we're going to see how wide and thick. So this is a very muscular tendon. This is all gluteus minimus coming in to insert on that trochanter there. And I just mentioned that because right over top of that is going to be those superior gluteal nerves and vessels. And then over top of that is going to be that L1, those L1 nerve roots. So I'm saying that this L1, that's more superficial, is a bigger problem than this is. I've seen that time and time again. Believe me, I've been through this over a decade. So this is the medius coming in to insert a little more anteriorly here. And again, once again, you'll see we have some more of that iliotibial band fascia over the top. So you're going to have an L1 over the top of that. So that's the ilioinguinal nerves coming over the top of that, iliohypogastric nerves coming over the top of that ilium there. There's gluteus medius, nice. More pictures. Okay, I was hung up on the gluteus medius a little bit. But, okay, now I'm just going to go through and say something that's more important. So here we have a cross section. So if we have pain in this anterior hip or lateral hip, you just have to be aware. This is superior, so we have L1, pretty much L1 nerve root, we call that iliohypogastric nerves over the top. We have our superior gluteal nerves over the top of the med. And then we're gonna have the piriformis tendon that's gonna come with the nerves of the piriformis, and the artery internus tendon's gonna have some side branches around it. So we have tendon coming from different directions. This is a cross section of a tendon, a cross section of a tendon. So we can see this is the trochanter, and a lot of these tendons, the artery internus and piriformis, a lot of that insertion is onto this conjoint of other tendons, maybe even more than it is on the bone. But that's a vulnerable area to have an injury to an artery internus or piriformis tendon. Those injuries are going to be more lateral hip to slightly anterior hip pain. And we're going to go back to that L1. So then this is L1 coming up over the ilium. So this is the ilium up here, and this is our external oblique, our internal oblique, and our transverse abdominis. And you see that L1 nerve root is kind of coming through this transverse abdominis plane. It's going to spin right up and go over the ilium right there. And you can see the pattern here. The nerve is coming across. It's kind of what we're looking at, this pattern right here. And that's the nerve right there. It's going to come across that ilium. So it's not a small nerve. And it divides very quickly. It spreads over that lateral cutaneous ilium. All right, so that's our nerves to the posterior hip. Quick overview, and I think that's pretty good for today.